Hello and welcome to The Path, the podcast from Lifestyle RX. My name's Dan, and joining us once again today is Dr. Byrne. How are you doing?
I'm doing great.
Perfect. So today's episode is all about nutrition. So we'll dive right in and we'll try and discuss as much as we can about nutrition and how it relates to type 2 diabetes. So first thing to go over with, I guess, is what are the key principles of nutrition that we talk about when we're improving metabolic health and trying to reverse type 2 diabetes?
Yeah, so we obviously picked a big topic for today and going to try to simplify it. When we look at nutrition in type 2 diabetes, and especially kind of around reversal of type 2 diabetes, there are some really key principles. And so what we try to advocate is more of a principle-based approach rather than a rigid diet or very rigid approach. So the first thing we look at from a principle standpoint is given the fact that type 2 diabetes is essentially an imbalance between your body's ability to respond to insulin and produce insulin, what we want to do is we want to limit, reduce, or eliminate foods that require a big insulin response. And so if we think about this for a second, it helps to sometimes think, how much glucose is circulating when your body is just at rest, kind of normal fasting glucose, and the fact that that's that 1 teaspoon, right? So there's only a teaspoon of glucose circulating in your body. So if you eat foods that have a lot of carbohydrate that gets broken down quickly, so these fast carbohydrates, they're going to require a lot of insulin in order to maintain that normal glucose. And we always use kind of the example of a bowl of basmati rice that's 7 teaspoons of glucose that you're going to absorb within 2 hours.
Yeah,
you're going to have to release some insulin in order to store that. So given that we're having challenges in type 2 diabetes of maintaining normal sugar and releasing enough insulin to do that, if we actually can change our meals such that we eliminate or reduce those foods that require that insulin, so those fast carbohydrates. In practice, that's the white stuff. It's sugar, it's flour, it's the starchy compounds. So that's the first thing. And the second thing that's related is, and very closely related, because a lot of the foods that have these refined carbohydrates are ultra-processed foods. And so avoiding the ultra-processed foods makes a ton of sense because these foods usually have a lot of carbohydrate that requires an insulin response. So, but they also, because they're manufactured foods, right? They're foods they're not whole foods. They're not kind of within the cells where they grew. They're kind of jammed together in a factory. They actually get absorbed super quickly, and they don't generate a satiation response. And so you eat 1,000 calories, but your brain essentially registers 600 calories, and so you're still hungry. And so we tend to overeat with ultra processed foods, and that's drives that energy overload state that is underlying the development of insulin resistance. So when you come to kind of those first two things, that's kind of the negative, right? Avoid this, avoid that. The positive side of it is actually just eat whole foods, right? So eat foods that come within the packages that they're grown in, right? So, fruits and vegetables, healthy proteins, meats, fish, right? Eggs, dairy. There's lots of whole foods that you can build your diet upon. And then we kind of look at it from the standpoint of if we're eating a variety of whole foods, probably the only other things that we really need to think about are protein. And the reason we need to think about protein is one, it's the biggest satiation factor. But two, we don't store protein in our bodies. Like our bodies will store fat, will store carbs that we eat, but we don't actually store protein. So we actually do want to be sure that we get enough protein every day. And from a satiation standpoint, we need to make sure we get it every meal. And so that's something that we have to kind of pay attention to. But there's lots of different ways that you can get enough protein. And then the kind of the final thing in terms of a principle that we look at it ends up being around fiber, right? And again, a satiation factor, but also a gut health factor. And it's just something that, since, the rise of ultra processed foods, the amount of fiber in people's diets has really decreased. So generally, if you start to eat whole foods, you're going to increase your amount of fiber. But we often kind of want to just check that people are kind of getting, 30 plus grams of fiber per day. So from a principle standpoint, you look at those principles, there's a variety of diets that can achieve that. So if you eat a Mediterranean diet, you can do that. You can actually do that eating a low fat diet. You can do that eating a low carb diet. We just tend to not frame it from that perspective, and we think that the best diet is the diet that you're going to follow. And the best way to get there is actually to take what you currently like and currently are doing and make these modifications within the context of these principles.
Yeah, and then I guess I'm thinking about like the protein and fiber. Like, what are some easy ways that someone could add more protein or add more fiber? Like, what are those foods that kind of have like a good amount of those two key ingredients?
Well, so on the protein side, obviously, if you're somebody that eats meat, eating kind of lean portions of meat or fish, poultry, you can really kind of, it's very visible kind of the amount of protein, and so often kind of the amount that you're going to need is kind of the equivalent to the palm of your hand, right? And so if you're a small person, your palm's a little bit smaller. If you're a big person, your palm's a little bit bigger. Yeah. And that's kind of easy in the sense if you're kind of having a meat and veggies type of dish. Foods that we really like, and talk about a lot in the program are things like beans, lentils, legumes, chickpeas. These foods are foods that are kind of interesting because they have a bunch of protein in them. They also have a bunch of carbs, but really slow carbs. They get absorbed super slowly. And a bunch of fiber, and they're a great way to kind of add this to your mix. Things like tofu, if you're vegetarian, become kind of a staple, or tempeh or other things like that. Little hacks that you can do. Hemp hearts are incredibly protein rich, and you can sprinkle hemp hearts on salads to get a little bit more protein. On the fiber side, really kind of, obviously starting with, eat a variety of fruits and veggies, you're going to be in good shape. Those beans, legumes, lentils, chickpeas, if you've added those from a protein standpoint, guess what? You got a ton of fiber with them. So you're probably in pretty good shape there. Psyllium husk, right? So the active ingredient in Metamucil, it's actually a whole food, and you can sprinkle that into different things. Those hemp hearts have a little bit of fiber. Chia seeds have a ton of fiber. So lots of different ways that you can get fiber. And part of it is just really looking in identifying kind of whole foods that you like, and building kind of your default meals.
Cool. And then when we talk about eating differently, changing how you eat, how do you actually, what's the best way to incorporate those principles into like your daily habits, and like what are some strategies for actually switching to eating in this more of a healthy eating plan type system?
Yeah, so I mean, the key here is just start slow. Don't try to change everything at once, because changing everything at once is really hard. You just got to keep track of a whole bunch of things, right? And so usually what we, as we've talked about kind of previously in the podcast, our whole mindset here is better, right? It's the better mindset, not perfect, but better. And so you just start and you just start to look at it, and you start to say, okay, what in my meals, or kind of the food that I tend to eat, where am I eating those fast carbs? And then what can I do to substitute them? Are there substitutions I can make? Can I decrease the amount of them? Can I gradually start to make change that way? And same thing with the ultra processed foods. Where am I eating them? What's the choice? Is there an easy alternative to that? And that's really the way. And it's just kind of starting. I like to think sometimes in terms of meals, right? And if you think of kind of breakfast, lunch, and dinner as kind of your three meals, a lot of us don't need a lot of variety at breakfast, so that's a fairly easy one to fix. So you start with what you're doing now, And what are some alternatives that you like, right? So, do you eat dairy? Do you like Greek yogurt? And okay, let's start with some Greek yogurt. We can add some nuts to that. We can add some berries to that. We can add some hemp hearts to that. We can add some chia seeds to that. Kind of sounds like my breakfast. um, often for breakfast, people only need one or two kind of variations. Lunch, a little bit more variety, and then dinner's a lot more variety. And so you just start to tackle things that way, and take kind of things that you enjoy and look at and kind of say, well, how can I make this a little bit healthier, right? Like, and so that's really the approach. And then when it comes, when you start getting some traction there, and you start seeing that you're making better choices, then you can start to just fine tune it and make sure, okay, does each meal actually have the protein that I think it has? Is that kind of appropriate for me? Does each meal have enough fiber?
Yeah. Okay. Awesome. And then whenever you're reading on the internet or listening to things, you hear often about these things called superfoods that supposedly are going to change your life or anything. Is there any like particular type of food that's like that, like especially beneficial for metabolic health or type 2 diabetes, or anything that is the opposite and should definitely be avoided? Like, what's the story with that?
Yeah, so the superfoods, they make really good magazine articles, right? And so, it's and they keep changing them, and then what they'll do is they'll come out and say that this food isn't as good as it used to be.
Yeah.
So, bottom line is, there's really no superfoods, right? Humans, we're omnivores. We're designed like by necessity. Evolution has designed us to be able to eat a lot of different things. The key is really whole foods, right? And so, if there is something to avoid, it's the manufactured or ultra processed foods. But in terms of whole foods, the eating variety is great, and I wouldn't really pay any attention to these superfood articles, unless you like the food, and it's a reason to feel good about buying your blueberries for your breakfast.
Yeah.
Then I would kind of leave it there. The ultra processed foods, so we get asked a lot, kind of in groups. Well, how do you determine kind of between an ultra processed food and kind of regular food? So there's a bunch of different things, right? One is when you look at the ingredient label, are there any things that you need a chemistry degree to be able to figure out, right? If there's some
Yeah.
chemical name that makes no sense. The second is, how many ingredients are there, right? And so,
Mhm.
generally, ultra processed foods have a lot of different ingredients, including those ones that are, kind of chemicals that you wouldn't have in your own kitchen.
Yeah.
Then you kind of look at it and say, like, in a reasonable world, is there any chance I could make this myself? Right?
Hmm.
Like, okay, I might need some expertise, I might need some, some kind of equipment, but is there
Yeah.
any thought that I could make this myself? And that gives you kind of a clue as well. The other thing is, and I guess we probably have to go back now to our grandmothers or our great grandmothers, depending how old we are. But is it something that 100 years ago you would have been able to buy? Because
Hmm. Yeah.
100 years ago there really wasn't any ultra processed foods. There was processed foods, right? Like dairy and cheese and things are processed, and
Yeah.
baking has a degree of processing involved. But these ultra processed foods really they're kind of post-war phenomena, post World War II
Yeah.
phenomena. And that's the stuff that, if you look at the rise of obesity and weight gain in our society, it really correlates quite closely with the rise of ultra processed foods. One of the stats that we use all the time in the program is 50% of the calories that Canadians consume are ultra processed foods.
Wow.
It gives you, this is not a small thing to address in your diet.
Yeah.
And you'll find that whether no matter how careful you are, these things kind of keep creeping in.
Hmm.
The other comment with ultra processed foods to think about too is when you eat out, right? So when you're
Yeah.
eating in a restaurant, they don't always cook all the things that they're serving you, right? And so a lot of things are actually pre-prepared and really,
Frozen and stuff.
yeah,
Yeah.
yeah, there really are variation of ultra processed foods. So,
Yeah.
um, but before I kind of rain on all these good foods that people enjoy,
Yeah.
I keep coming back to this. Remember, we're aiming for better, not perfect. And so, if there may be a meal that you like that is ultra processed, or going out to a restaurant and you kind of know that this is not great.
Yeah.
And what I kind of say to people is, look, enjoy. If it's something that you like and enjoy, then and you want to go do it, enjoy it. But be sure it's worth it, right? And so you may go out for, I don't know, that I always use this example of going out for pizza and beer with friends, right?
Yeah.
It may be something that you really enjoy. It gives a lot of value to your life to go have that evening. You know that it's not going to be hugely advantageous from your diabetes standpoint. So the question then it becomes, do you just completely stop doing that? Can you do that once in a while? And I think you can do it once in a while. And I think that when you do it, what you want to be able to do is kind of look yourself in the mirror afterwards and say, that was worth it. I really enjoyed that.
Yeah.
And then not do it every night of the week. And maybe even kind of prepare for that by, being sure that you're really active, and kind of have been on target with other things, during the week. So, we really don't have to be perfect here.
Yeah, for sure. So then, how do you address these common misconceptions that come up about nutrition and metabolic health? Like, a belief that to actually have a fully healthy diet, you have to have these extreme measures and like do everything perfectly, or that certain foods are completely off limits and you have to follow everything exactly how it's written down. Like, how do you balance that?
I come back to the fact that we eat 1.25 million calories per year, kind of on average. And when you look at that, it's just kind of astounding. There is no single meal or
Hmm.
anything that you eat that's that important in the context of 1.25 million calories. So if you take that, if you step back from that and you kind of think about it, it's like, boy, if you can build some good habits and some good defaults, so that the majority of what you're eating is actually really, really good, right? So it follows kind of our principles, then there's no one meal that's that important, right? And
Yeah.
you can have days that where you're really not on target, but over the course of that year, you're going to be on target. So that's kind of the way I tend to look at it. It's like, because we're talking about reversing diabetes in the context of changing your lifestyle. So your lifestyle is kind of your forever set of habits. Um, we don't need to be rigid about it. And really what we want to do is, if we just start to make those better choices, then more of the calories that we're consuming are going to be whole foods. More of them are going to be aligned with keeping better metabolic health. And we're going to make progression there, because if I'm eating better this week than last week, and next week I'm going to eat better because I'm going to keep tweaking things. I'm going to keep being conscious of things. Eventually we land at a place where, what, all that 1.25 million calories,
Yeah.
a million of them are great, right? And
Yeah.
and now it's kind of really, these foods don't have that much power over us at that point.
Yeah. For sure. That makes a lot of sense. And then, what kind of role do genetics play in determining, like, is there a best diet or, for like in terms of metabolic health and stuff? And are there like tests or assessments you can do to help people identify like what the best diet for them would be, or what the best dietary approach for their individual needs would be?
Yeah, so definitely a lot of questions about this, and people will, find stuff on the internet around genetic tests that you can do, or they'll do 23andMe or
Mhm.
Ancestry.com, or they'll do something where, you're told that this gene is very important, or increases or decreases your risk for diabetes. And
Yeah.
so, um, first of all, there's no single gene that's very important on its own. And really kind of what you want to think about is, if you step back and look at it. So, the function of all cells, how our cells work, there's information encoded in our genes, and also something called the epigenome, which I'll talk about in a second, but kind of encoded in our genes that kind of guide how our cells are to work. So the genome is kind of this complete set of genetic instructions encoded in DNA.
Okay.
The epigenome is important here because there's these chemical modifications to genes that either turn them on or turn them off, can amplify a particular gene, or they can kind of turn down a particular gene.
Yeah.
And the epigenome, so the DNA we inherit from our parents, right? So we get a copy of DNA from each of our parents. So that's where our genome or genetics is from. But the epigenome is these genes that get turned on or turned off really relate to our environment and our behaviors. And so kind of what we're doing, so if we think about from a lifestyle perspective, what we're doing from a nutrition perspective is going to be important. What we're doing from an exercise perspective, sleep is going to be important. Stress will be important. So each of those kind of lifestyle behaviors will have an effect on our on the epigenome, and so we'll turn on or turn off individual genes in individual cells. So it becomes very, very complex. So you step back from it, it's, we can't control the DNA that we get from our parents, right? We don't have that ability to edit our genes yet.
Yeah.
So we don't have that ability. And so it really comes down to this kind of combination of genes that we have, whether they've been turned on or turned off, and then the environment and behaviors in which we live. And so what we do is look at it from the perspective of, look, the things that we control are our environment and our behaviors. And let's work there. And let's start by making better choices there that will probably have some impact at the genetic level, but not in terms of changing the gene, but in terms of turning on or turning off particular genes and how things work.
Yeah.
And then, we see what works, and that's really kind of, the approach that we have. So
yeah, it's long and complicated, isn't it? Sometimes, but yeah, it's I guess the moral of the story, like, if you're a diabetic, get these genetic tests done to learn more, or
yeah, I pretty rambling answer. So no, I don't think that our diabetics need to go get genetic tests done. I don't think you're going to learn anything from that. I don't think you're going to learn anything from genetics that's going to guide how you should eat. I don't think you're going to learn anything in genetics in terms of, whether you have a predilection for weight gain or diabetes.
yeah,
I think it's wasted energy. I think, start with, what you're doing, right? Start with the behaviors and start working at that level. And then you shape your environment to make those behaviors easier. The good behaviors easier and the hard behaviors harder.
yeah. I guess the reality is the same strategies work no matter what your genetics are. So use them before you go looking at complicated tests or anything.
Yeah. And you definitely do find that, some people will have bigger responses to certain behavioral change, right? So some people will really respond to exercise. Some people will, but by and large, the reality is that, what we're trying to do is it's not that complicated. It's just hard to do in the context of our lives. And so there, it's like, keep it simple, focus on a few things that you're trying to modify or change and get better on. As you get better with those, some of those things just become habits, so you don't have to think about them, which allows you to focus on the next thing. Keep working that process day in, day out. We see it within 12 weeks, people are really different than they were at the beginning of the 12-week program. A huge change can be made. But after a year, it's even more. And usually kind of by that point, it's very, very sustainable.
Yeah. Yeah, it's the slow and steady, just continuing to make the changes, keeping on with them is what'll make the big deal. Yeah.
Exactly.
Yeah. Okay, so I guess we'll move then to our case study for this week. If you want to introduce it.
Yeah. So we're looking at the different subtypes of type 2 diabetes. So we've done a couple of them so far. And this case study is one on what we call weight-related type 2 diabetes. And I think it's a pretty good illustration of that subtype.
Okay, cool. We'll play it now.
Hi, Brendan Byrne, Medical Director of Lifestyle RX here. I've got another case study for you. This week we're going to talk about weight-related type 2 diabetes. So let's jump in. BJ is a 52-year-old woman that presented with type 2 diabetes at age 43. She came to our program on metformin with a hemoglobin A1C of 8.2% and a BMI of 29.4%. And her goals were to reverse type 2 diabetes and also to lower her blood pressure. So remember, all diabetes can be thought of as this balance between the pancreas's ability to produce insulin and the resistance that insulin faces in our body. So pancreatic beta capacity versus insulin resistance will determine the balance of where blood sugar control is. In BJ's case, her pancreatic function was pretty normal, around 85.1%, so essentially normal, but her insulin resistance was pretty high at 2.71%, and despite the metformin that she was on, that had tipped her A1C into pretty poor control at 8.2%. Now remember, insulin resistance is predominantly driven by fat in the liver. From the direct study, we tend to say 15% weight loss is generally required to lose the 400 grams of fat that is causing this problem. But as you'll see in this case, each person can be a little bit different. So this is a case of weight-related insulin resistance type 2 diabetes, or subtype 4. What we see here is moderate to high insulin resistance accompanied by some or minimal pancreatic beta cell compensation. So usually we'll see kind of normal pancreas function or slightly high insulin levels. And depending how the pancreas compensates, we'll either see moderately elevated or high A1Cs. These patients generally present in their late 40s, early 50s, and really what's happening is the weight gain over their adulthood is catching up to them. So the average individual in our society gains about a pound per year from the time they're 18 onwards. And so if you look at it, by the time you're age 50, you've often gained 30 or 40 pounds. This particular subtype is very responsive to weight loss. So just to review, there are 5 subtypes of type 2 diabetes. The case we're reviewing today is weight-related, which makes up about 22% of type 2 diabetes. Age-related makes up 39%, autoimmune 6%, severe insulin deficiency 18%, severe insulin resistance 15%. And we've got case studies on all these subtypes. So BJ began her program and learned the 4+2 diabetes reversal strategy. She took the 12-week course with a core behavior every week, and her goal was to achieve remission of her type 2 diabetes. So let's have a look at BJ's progress. She began the program at BMI of 29.4 and finished at a BMI of 26.8, achieving a weight loss of 8.2%. Her A1C, as we said, was 8.2% at the beginning. At the end, she was at 5.7%, and she's not on any medications. So she's largely achieved her goal of achieving remission. Now, it needs to be durable over time, but from a blood sugar control perspective, she's there. Let's look at her progress on blood pressure. So her goal was to normalize her blood pressure without medication. So she began the program, blood pressure 145/84, and finished the program 117/70. So she accomplished her goal. She did this by improving certain aspects of her behavior. So if you look at her nutrition score, it was pretty good at a 7, but she finished the program with a nutrition score of 9.5. From exercise, she began at a 3.9, so a lower score, and again finished the program at 8.8. So these core lifestyle behaviors have a huge impact. So the conclusion, with weight-related type 2 diabetes, weight loss has a dramatic effect on blood sugar control by reducing insulin resistance. We normally say that it takes about a 15% weight loss in order to achieve that. But as you can see with this case study, it can sometimes be achieved with less weight loss. Last words I'll give to BJ. And I think the last line is, it's hard to argue with success.
Okay, great. That was really interesting to see how that all worked there.
Yeah, and I think this is when we look at the subtypes, this is the subtype that has increased the most in our society in the last 30 or 40 years. And so what it shows really clearly is losing weight has a huge impact on insulin resistance and in turn allows for the improvement of hemoglobin A1C.
Yeah, definitely. Okay, it's time for the question of the week. So I know every week we say post any questions you have in the comments wherever you're watching this, or on the post in the community, and we read all of them. We'll put them on our list, and we'll get to them in each episode. So for this week, the question we've selected is, and it's actually a follow up to a previous question we've actually answered before. But why has my blood sugar gone up overnight if I didn't eat anything?
So we kind of cheated. We already answered this in a previous episode, but it is the single most common question we get. So we created a little video on it. So why don't we play the video and
Absolutely.
And maybe if you're listening to this, just encourage you to go into the community and watch the video there. Dan will post a link to it in the community.
For sure. We'll play the video answer now.
In this short video, we're going to discuss the dawn effect, a common phenomena for all diabetics. You go to bed and your blood sugars are low. You wake up and they're higher. You ask yourself, why has my blood sugar gone up if I didn't eat anything? This has to be one of the most common questions that people ask during the 4+2 Diabetes Reversal program. To understand what is happening, we need to review where blood sugar comes from. Of course, when we eat and while we are absorbing carbohydrates, the glucose in our blood comes from food. When that food is all absorbed and we are fasting, it is the liver that produces glucose. When we are at rest, the liver produces about 2 teaspoons of glucose per hour to maintain a normal blood sugar of 5.5 millimoles or less, essentially 1 teaspoon. The rate of glucose production by the liver is controlled by 2 hormones secreted by the pancreas. Glucagon increases the rate of production, and insulin slows things down. So what happens at night? At about 4 or 5 in the morning, your adrenal glands release cortisol. Cortisol is our get up and go hormone. It mobilizes energy for the day by increasing the amount of glucose produced by the liver by increasing glucagon levels. Normally, insulin balances this extra glucagon to be sure that the blood sugars remain in the normal range. But when we get fat in the liver, we get insulin resistance, and the dawn effect increases. To improve this and to have normal blood sugars in the morning, we need to lose that liver fat, which decreases insulin resistance and decreases the dawn effect. Resolving the dawn effect takes time, essentially the time it takes to decrease insulin resistance by losing that liver fat. Usually this takes weeks to months. Of course, if you are stressed, the extra cortisol from stress will increase the dawn effect. And if you're sleeping poorly, the extra cortisol from lack of sleep also will increase the dawn effect. Now you know that those higher morning blood sugars are from the dawn effect.
Okay, cool. So, and then the thought of the week.
Yeah, this one is so important. Remission is not a destination; it's a journey, right? And I have to remind people of that because it's a little bit like the dog that catches up to the bus. What now, right? So you know you're chasing remission, and you get there. And the reality is, all the things that you did to get there, you got to keep doing, and that's the nature of lifestyle. And so that's kind of where we just kind of keep coming back to this slow and steady, better, not perfect. And you've got time, right? And take the time to make the change and enjoy the journey.
Yeah, definitely. Okay, that's our episode for this week. So thank you all so much for listening. Thank you, Dr. Byrne, for being here as always. And like, subscribe, follow us, whatever you do, wherever you're listening. Share the podcast with other people who you think could be beneficial for. And ask your questions, and like I said, in the comments or on the post in the community, and we will go through them every week. So thanks again for listening / watching, however you view the podcast, and we'll see you again next week. Thanks.
All right. Thanks, Dan.
Bye-bye.